know why haters be telling me to mind my business when they're out here not minding theirs? Shut your mouth and enjoy the tea. We all know you're here for it, sis.
With Loga, fishing over. You a queen, wanna less than I'm a goose. Owamie, Owamie. Owamie, Owamie. Owamie, Owamie.
Hi ninjas! How are you guys doing? It's your girl, Netshisaulu, aka Miss Fear Focal. Bring back for our entertainment. If it's your first time joining me, you're most definitely welcome. Please do make sure that you subscribe and obviously hit the bell. I absolutely love you. Now, do not forget to follow me on Instagram. It's also at Boldly Owamie. Now, guys, today I actually have a treat for you guys. I've got a special guest who's also a close friend of mine, and this is Dr. Netshisaulu.
Hello everybody. I'm so happy to be here.
You're happy to be here?
Yes, I am.
Yeah, so guys, remember I actually had a video, and in the video I was talking about how I went and got tested for HIV after I found out that I was busy cheating. And so in the video there was a statement that I actually spoke about, which obviously concerned HIV and ARVs. And so I did get a very lengthy email from a ninja, thank you ninja, that was basically just trying to point some things out. And I do understand that there's a lot of misconception and a lot of just theories around HIV and ARVs. And sometimes when you're just not a professional, obviously you're not going to know everything. So that's why I decided that I was going to get a professional.
Okay. Thank you for having me, Owamie.
Okay. So we're gonna answer some questions. There are a lot of questions that we got from the ninjas. But I would like maybe for you to just explain to the people, like, okay, maybe just in your own words, who are you, what do you do, have you ever worked in the HIV department and all that? Yeah.
My name is Dr. Netshisaulu. I've been working for 4 years now, post internship and community service. I'm working at St. Rita's Hospital. I've been working in the wellness HIV clinic for 4 years now.
4 years.
Yes.
See?
I'm trained, well trained. Yes.
We got the good one. Okay. So maybe for somebody that just does not know anything, that has, like, we just know what we hear, obviously, and you're somebody that is working in the department and everything, what would you say? Maybe my first question would be, what is the biggest misconception about HIV?
Okay. Most people tend to understand how you can get affected. Maybe I can outline a little bit about it. Mm-hmm. So firstly, let me just explain what is HIV.
Yes.
HIV is not a disease.
Okay.
It's a virus that causes a disease, which if it's in the long run, we'll call it AIDS.
Oh, okay.
Yes.
So wait, so HIV is a virus, AIDS is a disease.
Yes.
Okay.
So you can have HIV without having the disease of AIDS.
Okay.
Yes, because it's a virus.
Okay.
So unlike other viruses, HIV, our bodies cannot clear the HIV out of our system. Okay. Unlike flu viruses that can just clear after a few days with or without treatment. Okay. With HIV, it's not like that. It doesn't clear like that. Okay. So you can be HIV positive without even having any illnesses. So most people think that being HIV positive means that you got diseases. Okay. No, you can still be HIV positive without being sick at the time. Okay. But it doesn't. It does mean that in the long run, there's a potential for you to be sick. So that's why we encourage people to get tested before even having symptoms of the AIDS.
Okay. Yes. So, but then, okay, before we get into the questions that you ninjas have, I didn't want to ask you any questions off camera because I'm sure somebody also has this, but I just want to find out, isn't it you're going to start with being HIV positive, and then you get the disease which is AIDS. Is the process reversible? Can you be able to move from AIDS to HIV?
Okay. So with HIV, firstly, there are 4 stages.
Oh, okay.
Yes. The first stage is you can be asymptomatic, meaning that you won't have symptoms.
Okay.
Yes. And then on the first stage, you can also have generalized lymphadenopathy. That's where you will have palpable lymph nodes in the areas where we found lymph nodes.
Okay.
Yes. So there's a second stage where you can have skin diseases, yes, that are not so severe.
Okay.
Then the third stage, you can have TB, you can have pulmonary TB, you can have pneumonias.
Okay.
It's not really complicated, but you go in there.
Okay.
And then the fourth stage is the A stage, where you have like complicated diseases, like a cryptococcal meningitis. You are bedridden for more than 50% of your time. So there are a lot of conditions that you can get at the fourth stage.
Okay.
So with the reversible, we can't really say it's a reversible per se, but if you test, let's say you test with and we find that you are in stage 4 of A, which is the AIDS phase, then you have cryptococcal meningitis, for example. We can treat meningitis, and now you are cured because it's curable.
Okay.
Now you are cured, but you still have the virus in your body because we cannot eliminate it. Remember, we do have ARVs, but ARVs are not there to cure the HIV.
Yeah.
They are just to suppress it so that it does not rapidly affect your CD4 count cells or the soldiers in your body that are fighting diseases.
Okay.
So we can't really say it's a reversible per se, but you will reach a point where you're not progressing.
Okay.
Yes.
Okay.
Yes.
So I hope you guys actually understood that. Hey, so I'm asking for some of you guys there that did not ask, but so what you're basically saying is that when you get the disease, which is AIDS, it's a matter of you're going to get a lot of there are more complications within that. So what doctors or health professionals can do is to help treat the things that are going to come with the AIDS, but not necessarily the AIDS itself, right?
Okay. Let me put it this way.
Okay.
So when we test you, we're testing you for HIV. So when you find that you are positive, then we determine which stage are you. By the looking at the presentations or the symptoms or the diseases that you present with. Because, for example, somebody can present with TB. That's when we'll think of excluding HIV, because we know not everybody who has TB has HIV, don't get me wrong.
Yeah.
But if you have TB, it means that somewhere in your life your immune system went down.
Okay.
Then you got the TB to be active.
Okay.
Yes. So when after testing you positive, we stage you. Yes. So after staging, we're going to treat the illnesses that you have at a time. Because you can present asymptomatic, but we still have to give you the treatment to suppress the virus so that it does not progress to cause all those diseases that will be AIDS defining stage, which is stage 4.
Oh, okay.
Yes.
So when it comes to ARVs, do you have different stages of ARVs, or is it like Panado, where you just get Panado and then like
for all the headaches?
Yeah.
Okay. So with our ARVs, before 2009, everybody who tests HIV positive will then be on a program where they will be checking their CD4 every 6 months. Okay. But then our government becomes so generous, and now everybody, it's called universal test and treat. Everybody that we test positive will then get treatment irrespective of their CD4.
Oh, okay.
Yes. So if whether you stage 1, you will still get your treatment. Okay. But in that period, we have something that called fast tracking, meaning that those patients that we find they really need ARV to save themselves to prevent, let's say, morbidity or severe diseases, or they need ARVs to actually prevent death. Okay. We prioritize them to get it within 7 days or as fast as we can after excluding diseases like TB that we first had to treat, or meningitis that we first had to treat before we give them ARV. So everybody who tests positive can actually get ARVs without saying that you have to wait for this much and that much.
Okay, so for someone that is sexually active, now of course we all know that you can get HIV from other different ways, but I think that the most the highest rate of how people get contract HIV virus is through unprotected sex, right? Or whenever, like condom bursts and stuff like that. So what I want to find out is that you as a doctor, how often would you suggest that somebody that is sexually active test?
Okay, so we have let me say 3 ways that we encourage people to test, right? If you're living with a partner that is a HIV positive, we then encourage you to test every 6 weeks.
Every 6 weeks?
Yes. And then if you're living with a general population where you're just having a normal I mean like a relationship where you don't know, or you know the status of your partner, or you don't know, then you can test at least twice a year, which is every 6 months.
Okay.
And then if you are at the high risk group, let's say our sex workers, then you also test every 6 weeks, because you are at the high risk, or any other job that you feel that this is a high risk for you to be transmitted with HIV. Then you test every 6 weeks.
And then when you're a woman, stay with your cheating husband. How often? How often?
That's the general population, or you just
that's the general population.
Yes.
As long as you don't know his status or
Yes.
whatever, you need to test at least
twice a year.
At least twice a year.
Yes, or once.
So ninjas, those. Okay, no, I just wanted us to laugh. I had to break the ice. Okay. Okay. So now there's also, like, there are many questions that came, obviously, that we're going to answer, but for now I just want to ask you the questions that I actually have in mind and all that. So now we need to also go to like PrEP.
Yes.
Right? And at most times, like, okay, first of all, what is PrEP, and when does one require to have PrEP?
Okay. So let me also extend it to also PEP. So we have 2 type of prevention for HIV transmission. Firstly, we have the PrEP. Obviously, you protecting yourself without even knowing the other person's status. So I'm working at the public sector, so that's what I know. So right now at the public sector, we have the PrEP that we give to our partners that the other one is positive, the other one is negative. We give them the tenamine that they take for at least 2 weeks before engaging in the sexual activity. Then you'll be protected. So you can't take it now and then think you'll be protected. You have to take it for at least 2 weeks.
And then unprotected sex with somebody that is HIV positive.
Yes.
Okay.
Or for sexual encounter for somebody that you really don't know. Let's say it's a new partner who doesn't want to test or anything like that.
Okay.
But it will protect you after taking it for 2 weeks.
Okay.
And then the other one that has come up now is an injectable that will be available, not yet available, but it will be available for our women. 2 months in injection is called oh my god. Okay, I'll give you the name.
The name, and then I'll just put it in here. Okay.
Yes. So it's there. It will be available.
It's not available yet.
Yes, but it will be available soon. It will be a 2 month injection. So every 2 months you have to go and repeat. That is also to empower our women to actually have a say in their sexual life, because some men will refuse using a condom for one reason or the other. So at least our women, we know that they will be protected. Then when it comes to to PEP.
Okay.
That is the post-exposure prophylaxis, right?
Oh, okay.
So the post-exposure, it's when now that you've encountered an incident or a situation where you think you'll be at risk of contracting the HIV. For
Okay.
example, people who are being raped,
Okay.
or you're working in sectors like health where you can prick yourself,
Yeah.
or maybe you've been involved in an accident where there were blood splashes, blood contamination between people, then yes. And also prevention of mother to child, which is also another prevention, yes. So with that, we give treatment for at least 28 days, and then after the 6 weeks of completing the treatment, including the time that we were taking treatment, then we test you again and check if you were really protected. So it's important that when you encounter a situation like that, you come to health and consult at a healthcare worker within 72 hours, because it's more effective if we use it within the 72 hours. So also with the mother to child prevention of mother to child transmission, we encourage our pregnant mothers to test so that they are on treatment if they are positive, and then also we also give our babies the prophylaxis that they take for 6 to 12 weeks to prevent transmission from their mothers to children.
Oh, okay. So now I just want to get back to the injection that you're saying is going to be available. It's not available yet because I've never heard of it. I think that would actually be very much exciting. Is it going to be that you get the injection sort of like the prevention?
Yes.
And then like after the injection you can be sexually active for 2 months and you're protected, and then you have to go and get it again?
Yes, that's how it's gonna work. You'll be getting it like your family prevention injectables that you inject every 2 months. You've got a return date, but remember, the most important thing, guys, is abstinence or condomizing. So the injection is it's just also in case where maybe we are in a situation where you can't do the condomizing or the abstinence, but we encourage abstinence or condomizing. So the injection will be there to help also the women that are being
Abused
or do not have that say in their sexual life.
Okay. So I would also like to ask this, even though it's kind of like a general question. I mean, as a doctor, you see a lot of things, right? And you see a lot of people, young, old, that come in, and obviously they're testing for HIV. And I'm sure by now you've had different experiences with people and how they receive the news whenever maybe they're being told that they're HIV positive, be it young or old. At the moment in South Africa, obviously, South Africa, the stats are saying that we rank number 1 in the whole world. So we've got the most HIV positive people in this country. And the second thing that I also saw, I don't know how true this is, but they were saying that it's between the ages of 16 to 24. So obviously that is when you are basically growing into a woman. Adolescence to womanhood. Yeah. So if they say like you have daughters, at what age would you advise your child to start being sexually active? Would you even have the conversation with your daughter?
I think as a healthcare profession, that is the most challenging thing that we encounter from parents.
Okay.
Yes. But I would say it depends on many factors. Some people are Christians, so they will believe that you will only have sex after
marriage.
Yes.
Okay.
But also it depends on the relationship that you have with your daughters. Yes. So we will encourage that. I mean, from crash, they're teaching them, do not touch my breast, do not touch my private parts. So when your child is old enough to understand what you're talking about, that's when you can start talking about the sex and the growth and the adulthood. I mean, like overall things that needs to be known by your child as they're growing up. So it's important for us as parents to have the good relationship with our children. Otherwise, we would not know if this is the right time to talk about it. Yes. But it shouldn't be like a bomb. Then you want to tell everything.
Okay.
You look at your
Gradually.
yes, and
The
the
relationship.
way your daughter or your children understand this sex life. I mean,
Okay.
also for our boys, it's important so that they know that our girls' children, they are also important. They must view them as human beings who have rights and also have that right to choose or to make a choice when it comes to sex life. So it's very important to educate both our children, girls and boys.
Both. Okay, because I mean, obviously, even boys, they can also
Yes.
contract the virus.
Yes, they can.
So it means like okay, like okay, so it's very important to have a good relationship with your children, basically. Yes. And I just feel like with daughters, they're a little bit more on the disadvantaged side because you have this old disgusting you people need to die. Okay, all disgusting men that actually go for kids that do not know anything and they're not fully matured yet. By the time they leave their adolescent stages, they've already contracted this virus, and you find that they've not even like slept with a lot of people. You find that maybe they've only slept with one or two people, and unfortunately they actually got the virus. So okay, no, I completely understand that. Now, ninjas, before we continue, we're gonna go ahead and get this ad break, and we'll be right back.
Hi ninjas, now I'd like to tell you guys about Bonnie Home's cushion covers. These are one of the best cushion covers I've ever received. You know you got that good cushion cover when even the zip is of quality, honey. The texture and everything is just on point. I saw some of you guys actually complimenting how good my bed looked, and I really don't want to lie. Those cushion covers, they had a lot to do with it, okay? So I will make sure that I leave the link in the description box where you can get it, or you can just go ahead and go to www.bonniehomes.co.za and you can get you some good cushion covers at an affordable price. Okay, now let's get back to the video.
Hi ninjas, welcome back, and we are still chilling with Dr. Netshisaulu. Thank you so much for coming. By the way, we're talking about HIV and AIDS and obviously ARVs. Now, I did ask you guys to ask any questions that you have, and there's a lot of questions that came for you. Okay, so I'm going to go ahead and ask as many as I possibly can. I'm gonna start with Instagram, and then we're also gonna go to YouTube because there were also some questions over there. So okay, Dr. Netshisaulu has actually gotten, you remember the name?
Yes.
Okay.
It's cabotegravir. That is the injectable prevention for our women.
Cabotegravir.
Yes.
It sounds like a French name. I'm just going to go and get cabotegravir. Oh, cabotegravir. Cabotegravir. Wow. Okay, so that's no wonder like it had skipped your mind. That's a very it sounds French.
Yeah.
So it's cabotegravir. I cannot wait for that to come. I feel like it's going to be a game changer, especially in Africa.
It will empower our women.
It will definitely empower our women for sure. Okay, so ninjas, the first question that I'm going to ask, I'm not going to mention who asked and stuff. The first one is that I'd like to know more about the issue of ARVs and your viral load. After how long does one's viral load become undetectable after beginning the ARV treatment, and the issue of not infecting others when the viral load is low?
Okay. So, as I've said before, I work in a public sector. Then, with the issue of ARVs, I will be talking in relation with our guidelines in the public sector.
Okay.
So, with ARVs, we use the universal test and treat, where, irrespective of your CD4 count, we're going to initiate you in ARVs.
Okay.
So, after the initiation, we will test your viral load after 6 months of being on treatment of ARVs. So we have different regimen that we put our client on, but the aim is to give the little pills as possible, and then also the frequency, like you taking it once a day.
Okay.
Because that's good for our clients. So with ARVs, we have the old first line regimen, which is 1 TFE It has different names, Atroiza or Dimune, those kind of names. So you take it once at night.
Okay.
And then we've got a new regimen that we also have now, that is TLD. It has a nice drug that called dolutegravir, which is good in lowering the viral load.
Okay.
Yes, that is what we're also giving now, and also changing those who have been on the old regimen. And then with our regimen, with TFE, although our blood collection is not, time is still the same, still the 6 months. If you're taking your treatment well, meaning that you're taking your treatment on time. Okay, I forgot to mention that with TLD, you can take it at in the morning or at night.
Okay, so you
Yes,
choose
you can choose
which time works best for you.
Yes.
Okay.
And then when we check the viral load, if you're taking treatment well, meaning that you're taking it on
Every
time,
day.
and then you also condomizing and not taking other treatment that have interaction with this drug, your viral load should be lower than detectable within the 6 months of taking the treatment.
Okay.
Yes. And then if your viral load is lower than detectable, or at least less than 400, it's the risk of you infecting the other person is also low.
Okay.
That's why we encourage our patients to have a lower than detectable viral load, so that they reduce risk of infecting their partners.
Okay. So what you're basically saying is that if somebody goes and tests and then they find out that they're HIV positive, if they immediately go on treatment and they take that treatment well, and they are not in any maybe other chronic medication that interferes with the drug, within 6 months you can live your life as if you're negative even though you're positive.
Yes, your viral load will be that low, lower than detectable.
So honestly, you guys, like, most of this information I'm also just finding out with you, so it means that it's really very important for you to test.
So that's why we encourage people, without having any symptoms, any illness, to go and test and find out if you're positive, so that you can have treatment, and you also prevent the progression of this virus to cause the AIDS that we talked about.
Okay. Okay. No, that's wow. Okay. So the next question says, how do you protect your unborn baby from HIV? Is it possible for it not to be transferred to the baby?
Yes, that's a good question. Remember, when you book at the clinic for that you're pregnant, we will also encourage you to test for HIV.
Okay.
We don't really force you, but it's very important to our mothers to test. So we will counsel you, we will give you information about HIV, we will give you information about the treatment and how to also stay negative. So if you test positive, we then start you on ARVs. That the time that you go test, it's important. The timing is important, because if you go earlier, then you can have that treatment for 6 months.
Okay.
Then your viral load will be at lower than detectable limit, reducing the viral load, also reducing the risk to transmit the virus to your baby. So it is possible. Also remember that our exposed babies are those who are born from mothers that are HIV positive. We do give them the prevention, which is nevirapine and also AZT, depending on the mother's viral load. So it is possible to have an HIV negative babies while you're positive. If you have tested earlier and you are on treatment, your viral load is less, and also your child is also on prophylaxis after birth.
Okay. So for women out there that go to the hospital, number one, they're not going to force you obviously to get tested. It's your choice. However, if you, for your baby's sake, it's always advised test, so that if you are positive, then you can start your treatment, and then you can reduce the chances of you infecting your baby. So ninjas, this is really important. I hope you guys are actually getting this. You're giving us like gold, hey?
Thank you.
Girl, I got a good one. Okay, so the next one says, if your partner is HIV positive and you're HIV negative, are taking PrEP, okay, will that 100% protect you from being infected? So guys, Ninja, some of you English, I'm gonna read it as it is, okay? So basically she's asking if her partner is HIV positive and she's negative, is taking PrEP going to guarantee you 100% that you're not going to get infected?
Okay. I'm sorry to say this, but we don't have 100%.
Okay.
So it will just reduce the chance of being transmitted. I think we at 90, is it 90, 94, 96%?
Okay.
Yes. Of reducing the chance of reducing the viral transmission to you, but
Okay.
we don't have 100%.
Okay.
So you can still use PrEP and condomizing.
Okay. Okay.
That's what we encourage.
Okay. And besides, the other thing that I think maybe you can correct me, from how I understand it, is that if your partner is HIV positive, and you are negative, so it means that it is both your responsibility to make sure that your partner that is HIV positive is taking their medication properly, so that their viral load is going to be low, so that their chances of infecting you are going to be slim. But nonetheless, you have to use protection.
So remember, as adults, we need to make decisions. Yes. So the first thing, as a positive partner, you need to disclose your
Okay.
status to your partner,
Yeah.
so that they will make an informed decision.
Yeah.
Yeah, for protecting themselves. But also you have the responsibility to not to try to infect your partner knowingly.
Yeah.
If you know that you're HIV, you need to disclose.
Okay.
Yes. So the other thing is, I mean, as adults, we need to engage in discussion about sex and how we live our life. Yeah, but then it's your responsibility to protect each other if you
Okay.
love each other.
Yeah. If you love each other. So if you're not loved, sissy. Okay, so the next one says, is it true that if a person's viral load is low or virus is undetectable, they cannot transmit the virus during unprotected sexual intercourse?
Okay, so we cannot say you cannot. We refrain from being 100%.
Okay.
Yes, we're refraining from that. But you reduce the chance of infecting your partner if your viral load is lower than detectable. But we
Okay.
cannot say never. We cannot say it doesn't happen. But you actually reduce the chance. We still encourage you to use protection, unless if you're looking for a baby, yes, then you can come to us. We give you PrEP and also engage in sex without a condom so that you can conceive.
So I know, what I believe is that there's no stupid question, okay? So it means that if a guy is HIV positive and his viral load is still detectable, is it possible for him to have a child that's HIV negative?
Yes, it is possible.
But then him having a child, it means that he can infect the mother, but then the child is negative.
Remember, when the viral load is lower than detectable, that is the lowest that viral load that also reduces the risk for you to infect your
Another
partner.
person, yes.
That's why we encourage for you, if you want to have a child, your viral load should be lower than detectable, because we know that at that level, the risk of infecting your partner is actually low. Yes.
Okay,
And
but if it's detectable, if they say you're a guy, you want a child now, but your viral load is still detectable, are you able to have an HIV negative child?
you can still have an HIV negative child, but remember, if you want a baby, it's better to come to healthcare practitioner and consult, so that we actually optimize your chances of having a negative baby and also not infecting your partner. Meaning that we want to check and find out why your viral load is high, or is still detectable at a rate where maybe it will give you a chance of infecting your partner.
Okay.
Yes.
Okay. No, now I understand that.
Okay, so the last one from the Instagram post, it says, if you have sex with someone with HIV and you take ARVs from that day, will it cure HIV?
Okay. Remember we talked about post-exposure prophylaxis. I think that's the question.
Yeah.
So post-exposure prophylaxis works within the 72
hour
keys.
gap.
So it really does. Remember, it's not just about the post-exposure, the treatment that we're giving you, but there are a lot of factors that are follows around that. Remember, it will also depend also on the viral load. It will also depend again on the exposure. Is it like many exposure or just once?
Okay.
Yeah. So the chance of being of for it being effective depends on many factors. But it does protect you from not contracting the virus. Yes.
Okay. So the next one, this is from Anonymous, and she says, I'm 4 months pregnant, and obviously when you first go to the doctor, the first thing they do is to take an HIV test, which mine came out negative. Last week I found out that my partner, who I found recently cheating on me, to go test, which his results came back positive. I went for another test, which was the rabbit, as well as the ELISA test, which both came back negative. I insisted to be on PEP, as I've had a sexual encounter with him last weekend of Jan, as well the past weekend. Now here's my question: is it possible for the results to come back positive even after PEP, as I took the pills post the mentioned 72 hours? How possible is it that he has had that virus for some time but has not infected me? Maybe because my cells are strong. I am not blood type O, I am B positive. Owamie, I'm so confused. On top of that, I feel betrayed. All I want to do is to save myself and my baby so I can move on with no issues. I honestly feel he ruined my life. Now for the next 30 days, I need to take pills. Thank you so much in advance for answering the question as well as giving advice.
Okay.
You're welcome, honey.
Yeah. So we have talked a little bit about post-exposure prophylaxis. Yes. So it's the effectiveness. It's more in the first 72 hours.
Okay.
Yes. But remember, sometimes in her situation, she might not know before that she has been exposed. That's why maybe she went later to get the PEP. So if it was after 72 hours, it also comes with reduced protection against the virus. But we can't really say for sure that the results will be positive or negative. Yes. Because we don't really know the viral load of the other partner. So we can't say for sure whether the results will be negative or it will be positive.
So which means that I'm sure that they've told her that after she takes the PEP, after 6 weeks, as you mentioned, she's gonna have to go and test again.
Yes.
Just to be sure. And which is also going to be very important for your baby's sake. Yes. And I just want to say that, Ninja, I'm really proud of you, because like she really took initiative to make sure that, you know what, you're cheating on me, go test. And unfortunately he's positive, and now she knows that she has, you know, had sexual encounters with him and stuff. So I know that can be a very scary time, but I'm really proud of you, and you're very, very strong. So keep going. So the next one says, hi Owamie, my question to the doc is, how is it possible that one finds out that they are positive and they don't take meds, and they sleeping with their partner without protection for years, and they even conceive a baby, but the baby and the partner don't get the virus? What could have really happened there?
So she's saying that, when did she find out that she's positive?
My question is, how is it possible that one finds out that they are positive and they don't take meds, and they sleeping with their partner without protection for years, and they even conceive a baby, but the baby and the partner don't get the virus? What could have really happened there? So it means that maybe that just...
So she find out after having the child or before?
But then how would they know that the partner was having HIV for years?
Okay. So we didn't really get the clarity on the question. But I will say that, remember, when you have the virus, most of the time, this is the question that we don't ask our clients. Where did you get it? We don't ask that question because we know that most people don't even know where they is. Because remember, there are a lot of ways that you can contract HIV. It can be through a blood transfusion. It could be through sex. It could be through a cut,
salon.
A lot of ways that you can contract it. So, but it's possible that you might have contracted it in other ways if it's not sexual.
Sexually.
Yes.
Okay. So for them to say that one partner can be positive but is not on medication, and the other partner is negative, and the other partner, I would just assume that it's the man here that's positive.
I feel like our
the question is very.
She's saying that she finds out that she's positive, but then the partner and the child are negative.
Okay.
Yes, and then she's not on medication. Saying that she could have transmitted it to the child and the partner.
Okay.
But then the other thing is, if you HIV positive, remember when we test, we use 2 kits.
Okay.
They are of different make.
Okay.
The other one we first test you, and the other one is to confirm the results that we have tested on the first kit.
Okay.
So if the first kit is positive, then we do a confirmation test with the another kit that is of different make.
Okay.
So if it also comes back as positive, then we take that as our results.
Okay.
But then if it comes back as negative, then we have the discordant results. Then we have to do HIV ELISA to actually confirm the infection, the positive results.
Okay.
So I don't know if she tested that way and then she also confirmed, and then if they were discordant, I don't know how she tested.
Okay.
Yeah, but that's how far I can go.
Okay. Well, I think that the advice that I would give Ninja is that, like, whoever that is, the partner that is positive, they should, number one, go on treatment. Like, they need to go and consult a health professional so that they can be on treatment. They can actually check their viral load and stuff like that, so that they will not transmit it to the other partner. And you may have had a child that did not get the virus, but then you may get a second child who possibly can, if you're not on treatment and all that. So it's very important for you to just go to the doctor and have things checked up. That's the advice that I'd actually give you. The next one says, hi Owamie, I found out I was HIV positive 2015 September. I immediately started my ARV treatment because I was also pregnant with my first child. So because I was sick from the treatment, I had hallucinations for months, and I would feel like I don't want to wake up as my head was heavy every morning. I stopped taking them. I've been using immune boosters, but I'm worried because I sometimes feel my CD4 is low. Do I go back to the clinic, or is it possible for me to buy something that won't make me feel as if I'm babalazed?
Okay. So maybe unfortunately for her, she could have went back to the healthcare worker and consult. Remember, the HIV are drugs, so you would have side effects. Okay. And what she has mentioned there for me, those are side effects of the treatment that she was getting. Okay. If she went back to the healthcare worker, they would have changed her treatment to something that is much better, that she can tolerate. Yeah, but it is not too late. You can still go back to the healthcare worker and consult. And then what we do in that case, we will take you reinitiation blood. We'll take your CD4 count, we'll check your viral load, we'll also check your creatinine, where it's checking your kidneys. And then we'll put you back to the treatment that works better for you. But then if you not, remember, with HIV, it has resistance. It's not like other drugs like Panado, where you can just take it and then stop it. But with HIV, if you just stop it, you can develop resistance. So, but we can monitor that and then assist you if you had developed a resistance to the ARVs, because we do have other regimens.
Okay, so would you say it's very dangerous to be somebody that is HIV positive taking your ARVs, and perhaps maybe you have side effects, or maybe you are having like, you know, other symptoms, headaches and stuff that maybe some people talk about. Is it dangerous to stop taking your ARVs?
It is. It is dangerous to just stop your ARVs. Remember, with ARVs, as I've said, you can develop resistance.
Okay.
So it's better if you've got concern about your treatment to talk to your healthcare worker, so that they change your regimen to a regimen that is better for you to tolerate. Because
Okay.
with resistance, it means that the ARVs, the very same ARVs that you were getting can develop resistance. And
Okay.
also we've got what it's called a cross resistance, meaning that even the other drugs of ARVs that you have never taken, you can develop resistance against.
So just so that maybe we can know, for some people that do not know, when you're saying that you can develop resistance, what is resistance?
Okay, so by resistance we mean that the ARVs no longer suppress your virus.
So what are the dangers of that?
The dangers is that, remember, with ARVs, they are not curing the virus. They
Yeah.
are not clearing it up from your body. They're just suppressing it. So if it is resistance, it's no longer suppress the viral load. Your viral load will keep going up. And that will be risk for you to develop
AIDS.
other diseases that will form AIDS. Yes.
Okay, so it is very important, ninjas, that if you are on ARVs, you continue taking them. And as the doctor is saying, if it's a matter of you are having like some side effects, hallucinations or whatever, go back to the hospital. They can change you and put you on different drugs,
Yes.
you know, that will best work with you and your body.
Yes.
So yeah, okay. So ninjas, we're now getting into YouTube questions. The first question that I'm going to ask is, I've a question regarding blood type O and HIV and AIDS. Is it true that it's hard to detect the virus when you're blood O type?
I don't have that information.
Okay.
Yes.
So what do you know is that any blood type
Yes.
can get HIV.
Yeah.
And okay.
Remember, HIV, when it enters your body, it attaches itself to your CD4 count cells. So, and on the CD4 count cells, they've got receptors.
Okay.
So unless you are saying you don't have those receptors, the CCR5 receptors where the HIV attaches, then only you can't have the HIV living in your body. After 120 days, it will die.
Okay.
Yes.
Are there people that are like that?
Yes, there are people who have mutation of CCR5 receptors.
Wow, so they're blessed life.
Yes.
Hi Owamie, I love your channel, thank you. My question is, does taking ARVs automatically make you immune from getting infected with the coronavirus?
No, it doesn't. But it does protect you from the morbidity. Morbidity actually means the severity of the COVID-19 disease.
Is it?
So if you're HIV positive and you're not on treatment, you've got a high risk of having a severe disease from the COVID-19.
Okay.
From the coronavirus,
Okay.
than somebody who's HIV positive while taking ARVs, because already their immune system will be
Boosted.
yes, high enough to fight the
Okay.
virus. Yes.
Wow. And then this is from me. I've heard you know, they were saying that people that are diabetic, they actually had high chances of dying from corona. I mean, I don't know, it's what I've heard.
So remember, the coronavirus will affect mostly those people who are, their immune system are low. Those are your
Okay.
HIV positive, your diabetics,
Yeah.
those who have malignancy cancers, or they are on
Okay.
chemotherapy or
Okay.
steroids.
Okay.
Yes. But
Okay.
it doesn't mean it doesn't affect other people.
Yeah.
But those are more at risk.
Okay.
Yes. You
Okay.
can have those diseases and doesn't contract the coronavirus.
Okay.
But they are at a high risk of contracting it, and also the severity of disease to be high, to be more.
Okay.
Yes.
Why is it that the government isn't handing out PrEP to men who are HIV negative like they do with ARVs for people who are positive? I listen on this radio.
Okay. Remember, for you to get PrEP, you have to go to the healthcare facility and consult. So most people don't go. Maybe it's because they don't know much about PrEP. Yes, we do have PrEP available at our government clinics and hospitals. So if you need it, you go there, they test you. If you're negative, they can put you on PrEP.
Is it?
Yes.
So is it free?
Yes, it is, depending on the logistics. I mean, if you're going to a clinic
Okay.
or at the government hospital,
Okay.
I mean, it depends the opening of the balance, but I don't know much about it. But it is free, like the ARVs.
ARVs.
Yes.
Okay. So the next question says, hi, can you and the doctor please discuss the new ARVs pills being rolled out in public hospitals and the effect it will have in regards to reproduction health and wellness? It will have for people living with HIV. Guys, your English, please. Increased birth defects and what opinions are or options are available if you are using the public health system but still plan on having children.
Okay, so I've said it before that we have two first-line regimen that we have. We have the old one, the 1 TFE or the 1 TE that we do have, and then we have the new regimen, the 1 TLD. So with the old regimen, it had tenofovir, emtricitabine, and efavirenz. And then the challenge was the efavirenz, which had more side effects, the psychotic side effect like the nightmares, the psychiatric side effects where you feel like you're having hallucinations. Yeah. And also it was also discouraging for those who are working at night, because when they take it, some will feel sleepy and you wouldn't want to sleep at on duty. And then the second regimen, new regimen, first line regimen that we have, the TLD, it has dolutegravir, tenofovir, and lamivudine. The dolutegravir is the new drug that they've added, which is good because it will suppress your viral load faster than the previous regimen.
Okay.
But also as a drug, it has side effects, although there are few, but I'll just mention the most important side effects. You have a headache. If you have a headache that is not responding to analgesia, then you need to consult your healthcare worker.
Okay.
If you're having GIT symptoms like diarrhea and vomiting that you can't tolerate, maybe you can't even eat, then you need to consult your healthcare workers. Also, if when you take it at night, you feel that you sleep too much, then you can take it during the day. Or I mean, not sleep too much, you don't sleep, then you need to take it during the day because it causes insomnia.
Okay.
And the other issue is towards our female of childbearing potential, those who can still have children. Yes, it has a risk of causing neural tube defects, but the risk is not that high. But we don't take advantage, or we don't take it for granted. We still encourage our women to be on family planning. If they feel they've got problem with family planning, they can still not being on any contraceptive, but they can plan their babies.
Okay.
Meaning that they can come and talk to their healthcare workers at a time where they need to try for a child.
Yeah.
So that we can help them. So if you still want to have a child in the future, not like close future, maybe like after
Maybe
a year or
3,
so.
okay.
Yes, you still can take the TLD, so it is still safe for you to take it, but you need to let your healthcare worker know when you're going to have the child, so that they can change it. Because you can take TLD, and then when you want to try for a baby, then we change you to the old regimen, and then we take it back. Because the child, remember, when the baby is formed, it's during the first 3 months of pregnancy. That's where the baby is formed, and that's where the risk is. So it's important not to fall pregnant on TLD without consulting your healthcare worker.
Okay.
Yes.
So I hope you got that, Ninja. I think you explained that very well.
Okay, thank you.
Okay, so this one, I think that there are some questions that are repetitive here, saying that how does it happen that someone tests positive, goes on ARVs, and then later on gets negative? Is it true that babies or infants of positive mothers that have taken the PrEP syrup at birth are later diagnosed HIV positive?
Okay, I think that's very important. Remember, with the first question that says, how come you can test positive now, then you're on ARVs, and then when you go test again, you test negative. So with HIV, the test that we do when we test you, it's detecting the antibodies.
Okay.
Yes. So those are your rapid tests. So if you're positive, that's when we put you on treatment. And then we do not use the rapid test to monitor for HIV.
Okay.
So we use the viral load to monitor the HIV. Because we know that HIV is not curable. So we're just monitoring the level of viral load to prevent morbidity and also to increase the quality of life.
Okay.
So you do not take treatment and then go and test. Because when you test, now that you've been on treatment, your viral load is so low that even the antibodies cannot be detected. But it doesn't mean that you do not have the virus.
Yeah.
If you stop the treatment and then after some years, you find that now you are positive. Because the viral load will start going up. So it's not advisable for you to take treatment, stop, go and test with a rapid, and then it comes back as negative and be like, oh, maybe I was not positive in the first place. You should be following if you're not happy with the test, you can request the ELISA, or you can go privately and test for ELISA to just confirm if you feel like you're in denial. But we do have counselors that we can help you, because most people are in denial first when they test positive.
And then again, which is very important, your fake prophets that will be out there saying, oh, this woman has been positive for 10 years. She's even been taking medication, Papa. Now she has tested negative. HIV has been cured. Do you guys now understand the scientific explanation of what actually happens? Because for me, I just, maybe I've been domed too much. I don't believe in those miracle nonsense anymore. No, personally for me, I feel like that's what happens. You can test positive, you can be on medication for years, especially if you're taking like as Dr. Netshisaulu said, she said that your viral load can be undetectable within 6 months.
Yes.
This is very important information, you guys. Like, I have learned so much today. I feel like I'm just like, yes.
The second question, for mothers who have children that are exposed to children born of mothers who are HIV positive. Yes, it is still possible that after taking the post-exposure prophylaxis, then your child could be positive. Remember, as a mother who's taking treatment, your viral load should be low if you're going to breastfeed your baby, because there's still a chance for your child to contract the virus through breast milk. So if you're breastfeeding your child, your viral load should be low.
Undetectable.
Yes.
Okay.
And that means you'll be taking your treatment well, you'll be condomizing to actually reduce the viral load.
Okay, so it is possible for you to breastfeed your child even though you're HIV positive. You just have to be on medication, and for the whole time you're breastfeeding, you should make sure that you're condomizing.
Yes. So your child can be negative if you are taking treatment well.
Okay. Please provide clarity about PrEP and how to administer it.
I think we've talked about PrEP.
Spoken about PrEP, yeah. So no, I think that the other thing again, I think administer it in terms of, this is also the question that when you were talking, I thought I was going to actually ask you.
Okay.
When you say on time, does it mean that if I'm taking my medication at 10 o'clock, it has to be 10 o'clock every single day on the dot? Or does it have like a space maybe where it's like 10, 10:30, 10, 11?
Okay. With the administration of PrEP, it should be also on time, like the taking of ARVs.
Okay.
So, but we know we human beings, we can do errors, but it's important to take it on time.
Okay, like the
But
same
if-
time every day.
Yes, but if you miss the time because of one thing or the other, you can still take it after. But it's very important to take it on time
Okay.
for for the virus not to for the our ARVs not to develop resistance, because the time that you give, the time frame that you give for the virus not to be suppressed, it can multiply millions and millions of copies
Wow.
within a short space of time.
Okay.
Yes.
But does that not apply to any chronic medication taking on time?
Other chronic medication, it's important to take on time, but they don't develop resistance. So the challenge that we have with ARVs is that
the
it develop resistance.
Okay.
Yes.
Okay.
So it's not gonna work anymore.
Okay. No, that I understand. Okay. This one says, hi Shbubu, hi Shbubu. Firstly, you look amazing. Thank you, gorgeous, my ninja. If you may please ask the doctor to talk about the physical changes in the human body when a person is on ARVs that are common and uncommon, and how to treat the thrush that is commonly found on the inner lips, especially in the mornings. Thank you in advance, my ninja.
So remember, ARVs are drugs, so they do have side effects, but we come a long way with ARVs. Before our patients were taking stavudine, which will affect the shape of your bodies by disposing fats, let's say, or from your legs to your stomach to the back. You develop buffalo humps. So now the ARVs that we're using, they are much better when it comes to those kind of side effects that affect your body shapes. Yes. But then we also have ARVs that causes you to gain weight, like your dolutegravir. It increases your appetite. Then if you eat too much, you gain weight, and then you can actually lose the shape of your body.
Okay.
Yeah. So it's just if those changes are not you can't tolerate them, then we can change you to a better regimen that can fit your life. And then the other thing with thrush, remember, thrush can develop to any woman. Even if you're HIV negative,
Yeah.
you can develop thrush. And thrush is not only sexually transmitted. The way the hygiene is very important when it comes to thrush. So using soaps, foam bathers, it can actually increase. It takes out it changes the
pH.
the pH of your vagina. It then causes you to have thrush. So it's very important to not use soaps when you bath your genital area. To just use clean water to bath, and not using your fingers to actually clean the genital area or the vagina, because it can cause a thrush.
Oh, I've been loving like salt bath with foam, and then I just sit in there and I soak myself with hot water for like maybe 30 to 40 minutes. I do this once a week. And I just started. Should I be concerned about my pH? Because I don't play with down there. Should I be concerned?
So if you're having challenges, then you need to stop. But
Okay.
it's advisable not to actually regularly use them, because they can affect your pH. And you
Okay.
develop thrush, recurrent thrush.
Okay. No, then ish. But I love them.
But if you're using the foam baths, you can just use minimal,
Okay.
not too much.
Not too much.
And but you don't go down there
Yeah.
cleaning.
No, I
You
don't
just-
clean down there. I just enter and then I soak myself
Then
and
you
then
you rinse yourself
Yeah.
with clean
water.
lukewarm water.
Lukewarm. Okay. So the next one says, I've heard of people delaying going on ARVs after being diagnosed with HIV. What does that mean, and why would people do that? What impact does it have? Why do some people have to immediately go on ARVs? The undetectable status that HIV positive people speak of, please explain in depth what that means and what it means for their partners. Can someone really take ARVs in secret? I think we've answered all this. It's the one that we didn't answer here.
Yeah. So as I've said, when we test you, we will offer you the pre-counseling test, where we're just giving you information about HIV, and then also for you to understand what it means, because most people, they don't want to test because they don't understand HIV.
Yeah, that's
They
good.
think it has a real stigma around it.
Yeah.
And then the other thing is, most people don't want to start ARVs because they don't have enough information around it. They don't even know that those tablets, you can just take one tab a day
Yeah.
to actually suppress the viral load. So some people have denial because of lack of information, but we've got our psychologists who can help them to understand feelings around knowing their statuses.
Okay.
And also, it's important not to delay taking ARVs, because remember the virus is progressing in your body, causing diseases that can end up being AIDS in the long run if you don't take treatment.
Yeah. So the question, why do people do that? It's mostly misinformation.
Yes.
Just not having enough information. And obviously when HIV came, like, it was just this huge scary thing that has this huge stigma, even though we still have the stigma around it, but I feel like it's getting better. We're able to sit down, talk
Yes.
about it. We do have people that are living positively, openly with HIV and stuff. So yeah. Does HIV and AIDS affect black people only, or can it also affect other races as well?
So HIV affects every race. It does not segregate. Yes.
Everybody. I Ketuli. You're black, pink, yellow. So the next one says, what are some of the early symptoms of HIV? Because I've had people get flu-like symptoms a few weeks after contracting it. Also, why do you think it's taken so long to find a cure?
Okay. So with the symptoms, yes, you can have a flu-like symptoms when the virus is spiking at the very beginning of their infection. But most people don't realize that, because depending on people, some will have severe flu-like symptoms, whereas some will have mild symptoms, and then they will take it as a flu, and then they will just leave it, and then it will just stop, because it's a reaction when your body is trying to fight the infection. Yes.
But then at that time when you're getting the flu, does it, if at that particular moment you get PrEP, can it help even though it's post 72 hours?
Remember, when you have those symptoms, you might not even think about HIV.
Yeah.
Unless if the person that you somebody who is positive and you slept with told you about it, or
Okay.
somebody that you pricked,
Yeah.
you know that they are positive. But
Okay.
if you don't know the other person's status, you
Yeah.
might not even think this is HIV. You'll think it's flu.
But if, let's say, maybe you just think of it, and at that time when you're having the flu, is there something that can still be done where maybe it can just be like, okay, the chances will be reduced, but maybe, because at that time, isn't it, it's a reaction your body is trying to fight. So if your body gets something to help it, can it still fight it off?
Most of the time, that reaction happens between 2 to 4 weeks.
Oh, okay.
So the post-exposure prophylaxis, we said it's more effective within the 72 hours.
Okay. No, okay. So at that particular time, if you test, you're gonna test positive.
So most of the time, you might even test negative, because that's when your body is trying to fight the infection. That's where the antibodies will be formed. So if you test at that time, you might be negative. But it's possible that your body has already made antibodies, and then you can test, depending also on the type of test that you're doing. So remember, with the rapid test, it will detect antibodies within the 6 weeks of you being infected. And then with the ELISA, it can be 3 weeks. And then with the PCR, it can be a week. So it depends on the type of test that you'll be doing at a time.
So would you say that the rapid tests, the ones that most people will just do at home, how reliable would you say they are?
If they are using 2 of different make, it is reliable.
Okay.
But then also the timing, it will be important. And
Okay.
also remember the window period. The window period is a time where your body, it will take your body to produce antibodies
Okay.
that are detectable on the rapid test.
Okay.
Yes.
Okay. No. Why do you think it's taking so long to get the cure? And do you ever think we'll get the cure Okay, I mean, you're a doctor, should not compromise it, but I think that they're still busy chowing money. But yeah, do you think they will ever find a cure for HIV?
I think they will, because uh, the scientists have not stopped. They still trying to find the cure. If we having better ARVs, we having prevention for HIV, and now we're still waiting for them to give us the vaccine. I think the fight has not yet is not yet over. They're still trying to get something.
Yeah. Okay. Okay, so the next one says, is it advisable to breastfeed when you're HIV positive and have undetectable viral load? Yes, I can answer this now.
Yes, it is advisable. Remember, the breast milk it's much more important to our babies than the formula. It's protective against other disease other than HIV.
Okay.
Yes, because our babies do not have the immune system that is strong enough to fight other diseases than HIV, but they get antibodies from their mother through breast milk. So breastfeeding, we still are advocating for that to the newborns.
Okay. Is the vaccine safe for HIV positive people? The coronavirus vaccine?
I don't know why you say it's safe.
Like, she's asking, is the vaccine safe for HIV positive people? I think that at this moment the vaccine is just coming, so I don't, is it safe for anybody? Like, I don't think that we know. Like, whether you're positive or negative, we
But
do
we
not
don't,
know
we don't
yet.
have information
Yeah.
about its unsafety.
Yeah, we don't.
With regards to HIV.
Yeah.
So I think it's safe
Yeah.
for
Yeah, I mean, if it's approved, it has to be.
Yes.
It has to have been tested even for people that are HIV positive and
Yes.
stuff like that.
Yes.
Okay, so the third one says they are changing the HIV tablet to a new one that you will take during the day instead of night. Will that cause baby? Will that cause baby to be born with disabilities? As at the clinics, they are telling HIV women not to try and have children while on the new drug. Study found that people who took the new drug, some have children born disabled. You actually explained this.
yeah.
She did explain this.
And also to add on that, we do have, remember, we talked about the family planning, but also in South Africa on our ANC we also give our women the folic, which also prevent the neural tube defects. So it is important for our women to actually plan their pregnancies if they are on the new drug, the TLD.
Okay. So the last question, Ninja, says, should people living with HIV be worried about getting any of the vaccines out there for COVID-19?
So according to the information that we have, we do not have information that says it's unsafe for HIV positive not to get the vaccine. Remember, even healthcare workers can be living with HIV. So we didn't get that information yet.
Okay.
So I think it's still safe for you to get the vaccine.
Yeah. Okay. So Ninjas, oh my gosh, those were the questions that you guys actually had. There were many, there were good ones, and I think that now, I mean, I don't know about you Ninjas, but I feel like I understand a little bit more now, because I mean, you guys know, like when I told you about that video, I was so scared when I went to test, because for me, I was like, I had a lot of misinformation. One of them being that they would say that if your partner is secretly taking ARVs and you continue to sleep with them being positive and you being negative, and he's on ARVs, that somehow their viral load is going to be high, and then they give it to you, and then now, like, it basically just progresses with you, against you. I don't know, like, if you understand what I'm saying.
So I would say that the way I'm understanding you, if your partner is HIV positive and taking treatment,
Secret.
well,
Yeah.
their viral load should be lower than detectable, which means that you are not at risk of contracting, or the risk of you contracting the virus is low. But then also remember, if you're taking your somebody's taking their treatment secretively, chances are they won't take it well.
Yeah.
They will miss the time. They will miss the doses. They will not live a healthy, positive life. So chances are they might not. Their viral might be high because they are not taking their treatment well, which is a risk also to their partner.
Okay.
And the other thing, most importantly, the risk for you who are taking treatment, it's more because you might even develop resistance.
Okay, so this is why I actually wanted us to like talk about, because that's why I actually had the misinformation. So if let's say your husband is HIV positive and you were HIV negative, now he infects you but he's on ARVs, it's actually dangerous for him because of you will be reinfecting him each time you guys sleep together, is it?
Yes, if you're positive, you will be reinfected.
Okay.
No, what are we saying now?
Wait, when you sleep together and you're HIV positive without protection, you keep on reinfecting each other.
Yes.
But then now one is on ARVs. How is it that he could develop resistance?
Okay. So remember, when we talk about HIV, we also talk about ARVs.
Okay.
So if this person is HIV positive and also taking treatment but not taking it well, then they develop a resistance unknowingly. So they will see by their viral load will keep on going up and up and up,
Yeah.
not being controlled.
Okay.
And then after they find out that they've got a virus that is not responding to ARVs,
Yeah.
now they've developed resistance. They have transmitted the virus that is already resistant to their partners. Now their partners have tested positive and now wants to start ARV. They are starting ARV. They have been infected with a virus that is resistant to ARVs, meaning that they might not even respond well to the medication of the first line regimen that will be given to them. After that 6 months that we talked about, their viral load can still be high.
Okay.
Yes, because they have been transmitted with a virus that is resistant.
So that's the part that I was talking about. I just didn't have the full information, but I've heard that it can be dangerous for you, but I just didn't understand how that would be. So in a sense, due to the fact that if somebody is taking ARVs secretly, and if maybe this is someone you're married to, it is going to happen. They're not going to take their medication on time every day because of they're taking their medication in secret. So it means that if maybe let's say today we're together and he doesn't have that time to sneak out and take that medication, it means he's not going to take, we're going to sleep, or he's going to take at a later time maybe when I've fallen asleep, which then can affect the viral load and have those chances of him actually getting the HIV that is resistant to medication. Now when he gives me that, when I go to start my treatment, I may be infected with an HIV which is resistant to medication, which now also complicates
your situation,
my situation. So it is very important for you to be vigilant and actually like check, especially if you've got a cheating partner, check, are they taking any medication? Search their pockets, search their car, become detective. I'm going to when you like detective wife. You need to search. It's not something to laugh about, but obviously it's a serious situation that we need to talk about. So I heard of something like this to say that it could be dangerous for you but I didn't know how, but now I understand. So okay, no, this was very, very informative. Thank you so much, Dr. Netshisaulu.
You're welcome.
Thank you so much for educating my ninjas out there. I know this is going to be long, but this is needed. Okay, we need to normalize talking about HIV, not only when we ourselves are positive. You can be somebody that is HIV negative and you educate other people on how to stay negative, and also just understanding everything. Like, just try to understand as much as possible, because knowledge is power, and we're gonna be able to prevent by knowledge. Sometimes they say ignorance is bliss, but not all the time, because there are people that are HIV positive right now that could have gone and get PrEP, but they didn't know that exists. They didn't know that, even after you have slept with somebody that maybe you just found out. I remember there was once this other book, or sort of like an article where a guy slept with a girl. Immediately once they were done, the guy was like, welcome to the AIDS world. Yeah. So yeah, it was back then in the day. I can't remember if it was an article, what had happened, or was it a book, was it a story. But immediately after sleeping with the girl unprotected, the guy was like, welcome to the AIDS world, like you've just entered because I'm positive. And obviously, I mean, if you don't have the knowledge, you just start crying, oh my gosh, I'm gonna be positive. But if you have the knowledge to say that you can actually go and get PEP, then you will basically be negative. And I think that this is something that we need to educate, especially even our youngsters, because unfortunately they are the ones that are, obviously as the stats are saying, they're mostly at a higher risk. So thank you so much for this.
You're welcome.
This is wealth. This is wealth, guys. So yeah, you can say goodbye to the people.
Okay, thank you for watching. Thank you for listening. If you've got questions after this, you can still give us those questions. We'll try to help you.
Yeah.
We are here for you guys. We are there. We'll be helping you with a smile. Don't be scared to come to our clinics, to come to our hospitals. We'll be ready for you. Thank you so much. Thank you for having me. Thank you for the face pic.
You're very welcome. No, thank you for being here, guys. Now imagine when you're walking in and this is your dog. She's so sweet about everything. And I think that like there may be other different topics that maybe they would want us to actually like discuss, because you have got all this knowledge and you are able to like put it out there well and stuff like that, especially like when it comes to like women, and stuff. We just have a lot, you guys. So thank you guys so much for joining us. This will not be the last. This is the first time you're seeing Dr. Netshisaulu on my channel. This will not be the last. I do not care how we do it. I'm gonna, even if I have to hunt you down, pin you down,
I'll be here.
we are definitely going to do this again. As she said, if you have more questions, please make sure that you comment down below. I do see that we also have some doctor ninjas that also like give their answers here and there. But thank you guys so much. And yeah, that's it, guys. It's a wrap. Bye ninjas.